this question, we have an LPN who's in the room with a client in physical therapy. The client tells the LPN, I feel like I'm going to have a seizure. Which intervention should the nurse implement first? All right, so she's having an aura. She feels like she's going to have a seizure. Sometimes patients know that. And we're looking for what should the LPN do first. So implementation is interventions or nursing actions. So for a nurse, implementation, action, or intervention. And one or two things. Safety. Can't really fix the problem because if she's going to have a seizure, it's going to happen. But we may be able to eventually get her some medicine to stop the seizure. When they're in status epilepticus, then we can give like a benzodiazepine. So fix the problem or maybe do something to help the patient. So it could be either one of those. What would be first? So you want to compare. Should she instruct the co-worker to notify the registered nurse? Should that be first? Any thoughts on that, or should we eliminate? Okay. No. All right. That's good. All right. So we got some no's on that one. So there may be something else she can do directly to help the patient besides go get some help. There may be something else. I agree. This one kind of puts off, goes directly to the registered nurse, and she probably does need to notify somebody for help. But there may be other things she can do. So we really want to focus on the patient at this point. All right, good. We got some no's. How about B? Stay with the client and time any seizure activity. Could that keep them safe or fix the problem, or will that help the patient? Okay, got some no's there. All right, so staying with the client is important. Timing them is important as well, right? Knowing how long the seizure lasts. So, that could be questionable. I agree that that's probably may not be the very first thing she needs to do. Stay with the client, time any seizure activity. This is most important probably when you're trying to report what happened and let the doctor know how long did it last, how did it look, what was the activity that was being experienced, was it tonic-clonic, what were they doing, and that will help the doctor diagnose and figure out maybe what's causing it or what's happening. All right, well, so what about C? We got a lot of no's, so we'll get rid of this one. Looks like we're down to these two. Assist the client to a safe position away from hazards or reduce the noise and dim the lights. Everybody says keep the C. Good. This is a keeper. Assist the client to a safe position away from hazards. So that directly is keeping them safe, and it does really help the patient. And it does focus on just the patient. All right. And it keeps them safe more than just staying with them and timing how long it happened. So all these things are probably good things to do, but what's first? C so far seems to be a good choice. How about D? Can we eliminate D? Reduce the noise and dim the lights in the room. Should we eliminate that one? Okay, yes, get rid of that one. Cross it out. All right, good. Awesome. So yeah, that is the answer. C is the answer. So the only one that was really going to help the patient at the moment that she's saying she feels like she's going to have a seizure is get them to a safe position. We don't know what position they're in, if they're sitting up in a chair, if they're walking or whatever, but a lot of times you'll see questions that say lower the patient to the floor, or put them in a safe position, maybe lowering them, getting them out of the chair if they're up in a chair, and get them away from hazards. So that's first, and then all the other things will come along as well. All right, so epilepsy, patients experiencing these seizures, they may have this aura. The first action we want to do is get the patient in a safe position and we want to make sure that the patient is not injured. So the LPN should stay with them, tell somebody else to go get the RN who can bring medication to prevent the seizure, or at least, control it, or hopefully eliminate it. Give them some lorazepam or something, Ativan. And noise and light reduction may be beneficial in preventing a seizure. So she's already feeling like she's about to have a seizure, so that wouldn't be a priority. Priority is going to be patient safety. And this is just a little weird little picture. Tonic phase, clonic phase, post-ictal confusional fatigue. So remember, patients are going to be a little confused and probably lethargic and sleepy and tired after a seizure. That is common. So when you're trying to pick patients who are a priority to see, if they tell you that the patient had a seizure and they're just sleeping, and they don't tell you their SATs are low, or they're having problems breathing, or there's no airway breathing circulation issue, then they're probably okay. They're just got to sleep it off. And we would want to reorient them soon after they're awake, and let them know what happened, because a lot of times they'll be kind of confused or don't remember what happened. Other things you can tell, he's kind of looks like he had some stuff coming up from his mouth. So if we were there, we want to turn him off to the side during the seizure. Just kind of turn them over to the side. So if they start vomiting or having some emesis or some secretions coming from their mouth, they won't aspirate.